Okay, guys, this is Dr. Nima, and we're going to talk about Chapter 3 for Dental Science, and it is about fundamentals and preventive curvatures. So, technically, we'll get to know a little bit more about the anatomy of the teeth and what are the things that are important for our work to know, some terms, and it's a small lecture, compared to the other ones. So, let's go ahead and start. We have some areas of contact, and these are usually between the teeth. So we know that proximal or interproximal areas technically are the areas between the teeth. So mesially and distally, right? We have intraproximal contact. This is the proximal, mesial or distal. We have proximal contact areas. So these are the areas that are found on the teeth, on the mesial and distal side of the teeth, and that's where each tooth touches the other tooth. These are important to keep our teeth clean so food would not get caught underneath in that area here in the bottom between the two teeth. And at the same time, it will help support other teeth because they're all kind of tucked together, and it will help encourage them. So these areas are important, the contact areas are important, and when we restore the teeth, like when the dentist is trying to restore the teeth, this area is important because we have to restore the contact in it so that, again, it will completely, tightly close the space. This will keep us also, still allow us to do the flossing between the teeth, but not too open where food can get stuck. So that's the importance of the contact areas, as we will see. So these are the interproximal or proximal surfaces where each tooth touch each other, so it would prevent the foods, the debris from packing between the teeth, right? And then it will offer support, encourage for other teeth, and these are usually on the widest part of the crown. So this is the white part, and then it gets into that area. These are not to confuse with the contact points, right? They have points and we have areas. So the contact points are the points where a cusp from one tooth touches the cusp or the occlusal surface of other tooth on the other arch. So that's just not to get confused with these. As we said, the contacts that we have, the proximal contacts that we have, we should have them just tight enough so that we don't have open contact. So we'll have open contact if they're not tightly touch tightly each other, in the contact area. So we'll have some open contact, as you can see here. And if the open contact is too wide, they will call it a diastema. So that's the diastema if it's too wide. Sometimes they still call it diastema even if it's not that wide, like almost any opening, but we're just basing it on this chapter. So if it's just a small opening, it'll be just an open contact. When it gets bigger, that is a diastema. So sometimes a diastema would be better than a small open contact. Why? Because the small open contact can still trap food between the teeth, so food would get caught in here, and then definitely bacteria would happen and caries would happen and some periodontal damage would happen. But when you have an open contact that big enough, then it's not good, but at least it's not trapping food in here because food can spill out and you can brush it easily and doesn't get caught in the area. So that's kind of to have a note. Okay, so these spaces that we said, the proximal technically spaces, we have what we call them an intraproximal spaces, technically between the two teeth, right? And that space in the normal pattern, in the normal healthy gum, will be occupied by interdental papilla. And that is the interdental papilla here. You can see this technically part of the gum, and we kind of talked about it in preventive as well. But in healthy gums, these interdental papillas would fill on this space and the interdental interproximal spaces, and it will cover these areas, and definitely it will help not to get any food to get in there. There's no opening. It will have some nourishment. So that is all, again, healthy, unhealthy teeth. So that's the interproximal or interdental papilla. We have also what we call embrasures. So technically, embrasures, these are spillways or opening between the teeth. So if you look here, we have a space between each teeth. We're looking here from occlusal view. We're looking at from the top of the teeth. And you can see there are some openings here. And these are called embrasures. Technically, the embrasures would be based on the location of the contact area. So you can see here, we have a lingual embrasure because it's on the lingual side, right? And we have a buccal embrasure because it's on the buccal side. We even have occlusal embrasure, on that side occlusally, technically. And we can have a gingival embrasure, but that is only if the space is not occupied by gingiva or bone. So when we have bone recession, here, as you can see, we have bone or gum recession. That's the gum line here. Here, the area is covered, so we have the interdental papilla. Right? And then here in this space, we don't have any interdental papilla, so that's why we would call it gingival embrasure, or also it can be called cervical embrasure. Or cervical embrasure. Same thing. So these are the embrasures, and they're actually helpful. These are, by the way, the incisal embrasures. You can see we said there are occlusal embrasures because on the posterior teeth we call them occlusal, on anterior teeth we call them incisal, as you know. So they would allow food to be directed away from the contact area. Again, this would help not to get food impinged under the gum. So help food from packing and damaging the papilla, allow passage around the tooth, reduce the forces on the occlusal trauma, allow self-cleansing, and definitely also help to massage the gum and stimulate it. So when the food is pushed a little bit away, just enough for the food to touch a little bit and stimulate the gum, that's what we want so that we have a healthy gum. We have the facial and lingual contours, and this is also part of the cleansing or self-cleansing of the teeth. And we also kind of talked about that, and you can see the contour of the tooth on the buccal side, or this may be the facial side here because this is an anterior tooth. That's the facial contour, right? And this is the lingual. And technically this is the normal shape of the tooth. The normal shape of the tooth would allow us, or would allow the tooth to reflect the food that that we eat, just enough so that it can go away from the gums, but at the same time just enough to touch slightly the gums and allow some stimulation and some massaging of the gum so that it will still have the blood supply and still be healthy. And technically studying these and knowing these, this would allow us to replicate them. So when we are actually redoing a tooth or making a crown for the patient or refilling it, we have to follow the contour, the normal contour of the tooth to make sure that we're actually applying these principles so that we still have cleaning of the tooth, not getting food caught, and helping the gum to stay healthy. So you can see, allow some frictional massage to the teeth, to the gum. It helps deflect the food off the tooth. If there is too much deflection, as you'll see in the next picture, this would leave the gum without the right amount of stimulation, and the gum would have disease. If it was too little deflection, then that will be actually forcing the food to go inside of the gum. So if you see the next slide here, this is the okay good amount of contour on both sides, lingually and buccally. And you can see that the food is deflected, and at the same time it is touching the gum a little bit to stimulate it. This one, when we have too little deflection, and you can see that food most probably will get caught in here under the gum, so it's not deflected at all. And this is where you have too much deflection, too much away. The contour is just too big, and this will take the food completely away from the gum. And again, the gum will not be stimulated, and there will not be enough nutrition and nourishment for the area. And again, we can have some gum diseases. Again, continue with technically the self-cleansing areas or qualities of the teeth. So as we said, contours are part of the self-cleansing features of the teeth. So other things, definitely we have the saliva, the tongue, the lips, the cheeks. All of that help to keep our mouth clean. Definitely this would be better when you have smooth enamel and anatomically corrected shape, and that's again what we were talking about, having the correct contours on each side of the tooth to be able to have it to deflect the food just enough, and same thing to have a smooth side. Definitely if you have deep pits and fissure, this can retain debris, and that's why we do the pits and fissure sealants. Rough edges can also help maintain bacteria, and again that's why we have to make our fillings smooth. And also there are some other term that we call overhang filling. An overhang filling is a filling that, like here, as you see, it goes under the gum, so it doesn't keep the shape of the tooth. That's the shape of the tooth. And an overhang filling can be extra and goes under the gum. Food will get caught in here in this area, and definitely we'll have some inflammation and even bone loss. So overhang fillings can be harmful for the teeth because again it can build up plaque, bacteria, and then that will result of the bone loss. Well, this was our lecture for chapter 3. Again, it was a small short lecture but with good information to know about the different areas of the teeth and the different functions of them as well.